Liposuction has long been a popular but extreme way of removing fat cells from the body, and with it often comes extended periods of bruising and a long recovery time. But now there is a new technique that uses water to flush out those fat cells, and here to discuss it with us is one of the pioneers of the technique, Dr. Roger Bassin. Roger, thank you so much for being here with us today to explain this fascinating new technique with us.
Thank you for having me.
So let's start out with the machines that you've brought with you, because these three here essentially do the same thing. Is that right?
Absolutely.
They melt the fat cells.
They melt the fat. So what is important for people to understand, because the advent of these newer technological procedures in body sculpting started out with the invention of the fat melting device called the Smart Lipo. That was the first one to come out, and everyone knows the name Smart Lipo.
Absolutely, and everyone was very excited about it.
Very exciting technology. What the Smart Lipo does is a device that will actually put energy through a laser to melt fat. So what this does is it will melt the fat and also put heat into the skin so the body can tighten the skin.
Right.
Okay. Now, a lot of people don't understand that the fat still has to be removed. So when the public opens up a newspaper locally and they see Smart Lipo, or they see Slim Lipo, or they see Cool Touch, or they see Laser Tight, okay? They're thinking, wow, I just can go in there and this fat melting device is going to come in there and melt my fat.
Melt off the fat.
And then I just go away. But they don't understand.
It then has to be removed.
Absolutely.
And that's where you come in,
that's
right?
That's where I come in, and that's where the Aqualipo concept comes in.
Okay.
Previously, before the body jet was introduced, patients would have the lasers melt the fat, but they would still have to have the old style liposuction cannulas go in there and pretty much make mashed potatoes out of them to get the fat removed. So you were still subjective to the old style liposuction risks and complications, such as bruising, swelling, damage to the skin, damage to the muscle, damage to the nerves, damage to the blood vessels. Now that we have a brand new concept and a new way to remove the fat, we've taken all those risks and pretty much thrown them out the window.
All right, you call that the AquaJet?
I call this the body jet.
The body jet. All right, so before we get over there, let's just really quickly go through these. They're all the same. They do the same thing, right? I mean, they're not the same machine, obviously, but is there one that you would recommend for a certain patient over another?
No, I really wouldn't recommend one versus another for a patient.
Okay.
Really, these devices, the technology's here.
Right.
Okay, so it's really on the doctor in terms of maybe their finances or their relationship with a particular laser company as to which device that they're going to bring into their office to offer the patients. But I look at it as they're all on par with each other, because they all accomplish the same goal of melting fat and putting heat into the skin to get skin tightening.
And the next step is the body jet. Let's go take a look at this.
Let's take a look at the body jet.
This is what we use then to suck out, or actually flush out is a better description, right?
Absolutely.
The fat cells once they've been melted. And tell us the advantages of this.
Okay, so let's take a look at what we will call a typical liposuction cannula. This is, you can go to any traditional style liposuction doctor and they'll have a cannula that looks very similar to this. The difference is, though, in order to get the fat to come out, the doctor would have to use their arm kind of like a piston, very fast back and forth motions. A lot of people have seen it on the extreme makeover shows.
Right, and that's what causes the bruising, right? That kind of.
Absolutely, we call these strike injuries because you're striking the body. It's hard to not bang into the skin, bang into the muscle, disrupt the blood vessels, disrupt the nerves, because you're banging it back and forth really fast. This is different, because instead of using a tremendous amount of manual force and manual labor to get the fat out, we're using this like a violin. It just glides back and forth, and it will flush out the fat that's been washed out by the power jet that I'm going to demonstrate here in a second, and it's just going to literally wash it out. It's like power washing the fat out.
Well, we do know that, even this is a relatively new technique, but we do know that studies show that most people, 84%, who have the water technique versus the traditional liposuction, have no pain after 4 days.
Absolutely.
Whereas far fewer, you can say that about the traditional liposuction.
Yeah.
So we do know that this is very helpful when it comes to recovery time.
Right, and it makes a lot of sense, because the whole purpose of this cannula here is really just to collect what was flushed out, versus the old style when you're banging into the muscle, banging into the skin. So that's traumatizing to the body.
So the average patient comes in and wants to get this done. What is it, a lunchtime lipo?
Absolutely,
really?
Absolutely. My patients will drive themselves to the office, drive themselves home, go back to work when they're done, go back to work the following morning. We're finding that I'm getting zero blood whatsoever removed with this technique.
Wow.
Because the water just pushes everything aside.
And what about results? Because that is one place the studies are still not clear. Right now it looks like the results are comparable to traditional smart lipos. So what do you say about the results?
Anecdotally, you can't find in the literature a lot of studies that will say, oh, well, amongst my patient base, I had, 20% of them needed touch-ups and got lumps and bumps and dents, because that would be a doctor airing his dirty laundry, so to speak. But commonly amongst our profession, we know that traditional liposuction is wrought with these complications of lumps and bumps and dents. With this procedure, I have yet to have one patient require a touch-up.
Really?
The results are unbelievable, unbelievable.
And who is the perfect candidate for Aqualipo?
Well, really, it's a patient who has a trouble spot.
Just a trouble spot, though. This is obviously not for obese or seriously overweight folks.
Well, neither is liposuction in general.
That's right. No, I'm just making that clear.
Yeah, absolutely. So these are for patients who have the menopausal symptoms and they have a lot of trouble spots, and they can't get rid of it through diet and exercise. Who have
those. All right, Dr. Bassin, thank you so much for explaining this fabulous new technique.
ABC News Now. Good to know.